So today I'm going to deal about emergency disaster management and the emergency care of disaster. So what is the introduction? So disaster is the causes of damage of ecological distribution and loss of human life and deterioration of the health and health service. So disaster is not confined in particular part of the world. They can occur anywhere and any times. Okay. So last we can see the flood on the Chennai and some north side in India. Okay, so Tamil Nadu. Then disaster nursing. So disaster nursing can be defined as adaptation of the professional nursing skills in recognizing and meeting the nursing physical and emotional needs resulting from the disaster. So what is the types of disaster will be natural and man-made disaster. So natural means Donald hailstorms, then tsunami, floods, earthquake, then communicable disease, so corona and all. Man-made disaster means fire, explosions, toxic material, pollutions, terrorist attack, and transportation accidents. So that is and all. What is the goal of disaster nursing means to meet immediately. Just a minute. To identify the potential for a secondary disaster, then appraise the both risk and resource in the environment, and conduct inequalities to assess the healthcare to appropriate resources. Then to empower the participant to advocate their own health and well-being, to respect the cultural, lingual, religion, families to health promotion activities, promote the highest quality of life survey. Okay, so principles of disaster nursing means rapid assessment of the situation and nursing care, then triage and initiation of the life. Book are only you can take no issue. To select use essential nursing intervention or the elimination and non-essential nursing activities. So evaluation of the environment, mitigation of the removal of health hazards, prevention of the further injuries or illness, and leadership in coordinating of the patient triage care and transport during the times of crisis. Then teaching, supervision, utilization of the auxiliary medical personnel voluntaries, and provision of understanding, compassion of the emotional support to all the victims and families. So health effects of the disaster means disaster may be causes of premature death and illness and injuries. So it's a local healthcare in infrastructures. Then disaster may affect the psychological, emotional, and social well-being of the populations. Then may cause a shortage of food and severe so nutrition deficiency and all will be there. It's create large population movements. It's create environmental imbalances. So phases of disaster means pre-impact phases, impact phases, post-impact phases. Pre-impact phases means it's the initial phase of the disaster. It's actually occurrence, a warning to signs first possible danger, possible danger to a community, weather network and satellite, many meteorology disaster can be predicted. Then role of the nurses during the warning phases, that is preparing to the shelter and emergency aid stations and establish the contact with emergency service group. So then impact phases, ongoing process, that one. Okay, so it will be disaster actually happened, it's entering the hardship or injury to the trying to survey. Emergency operation center may be put operations, that service center communication of the other government agency and all. Healthcare provide the staff shelters, then shelters and all. As a nurses member of disaster action the team, the nurses responsible psychological support of the victim in the shelters. Then post impact phases means that is denial and strong emotional. So during the stage of the victim maybe deny the magnitude of the problem, have not fully registered. Strong emotional response means the second person to aware of the problem, then overwhelming and over bearable and all will be there. Then acceptancy. So that is stage say the victim maybe accept the problem to cost of the disaster to concentrate effect the solve them. Okay, then fourth stage means it's a represent of recovery from the crisis reaction that back to normal. Okay, so what are the disaster management cycle means? First, disaster is the impact. That time we can take the response, then the recovery, development, mitigations, then preparedness. Okay, then response. What are the response we can take? So actually, implementation of the disaster plan is the respond the activities need the monitor and adjust the changes of situation. So a hospital healthcare team, public healthcare agency immediately during the disaster, we can emergency, we can do in response. Then recovery. So recovery is the staff need to recovery to the all the survey patterns. Then service we can give to time to turn routines everything. So the activities undertaken to the community and components of the emergency disaster to the restore restore the minimum service and move move towards long term restorations. So debris the removal and care and shelter damage the assessment. Then evaluation and development. So what are the evaluation we can give? So this is the basis under you can planning and response review the list attentions. So employee and community and all to anxiety to relieve the while operation times. Then essential formal evaluation to determine then the problems and all identify to resource the activities. So mitigation is the step that taken to lessen of the impact to disaster. Should one occur, can be considered to the prevention of risk reductions. So example that activities is installing and maintain to pack generate power. So that power and failure and cross training everything we can maintain. So then preparedness, so risk assessment. So evaluate the facility to vulnerabilities and vulnerability of the disaster. It's a weather patterns or geographic locations and expectation related to public events. So that is age groups, then facilities, industries, everything hospital site we can check. Okay, so example nuclear power plant, chemical factory and all. So here we can, if any disaster happen, we can see first triage category. So here triage categories means first one red. Okay, when victim happen, this slide is not clear, but I can give some notes. Okay, that victim is serious injury that will happen to life threatening. So we can give the immediate attention to the red color. Okay, so that require maybe immediate surgery, other life saving intervention have to first priority to the surgical teams and transport to advance to the facility to can't wait and we can survey to immediately treatment, that is red color. Class 2 one urgent, yellow delayed means we can delay for 20 to 30 minutes. That victim are seriously injuries and whose life is not immediately threatened, then can delay the transport and treatment for 2 hours. Their condition is stable, but the movement required to watching by the trained persons and frequent retriage will need to hospital care. That is the triage to yellow car. Then class 3 non-urgent green and minimal. So walking wonder the casually required to medical attention when highest priority patient have been evacuated, then may not require monitoring. That patient victim whose care transport may be delayed to 2 hours or more. That one is we can take the delayed. Okay, so it's a minor injury, walk wounded and closed fracture or sprain, anything will be there. Okay, then class 4th expanded black. So there are so severely injury they will die for the injuries possible in hours or days. Okay, so large body bones and severe trauma, then radiation doses, life threatening medical crisis, that is under unlikely survey means we can wait. Okay, so dead or expected to die means massive head injury, extensive full thickness burn and all we can use for black. Okay, then organize effective disaster system. So this is for personally disaster skin is a rules of the functions. The disaster scene is usually usually broken up is a 3 zone. Okay, so first is disaster zone, then treatment zone, and transport zone. So disaster zone means actually location of the incidents from the patient are removed as soon as possible. Majority of the disaster personally sent to the zone initially. Treatment zone means it's the assessment of each patient and treat the injuries and prepare the transport. Then transportation, it should be situated to directly next the treatment zone, that so ambulance and other vehicle and all can load the patient to leave the hospital and delivering appropriate patient care. So what are the triages must be equipped means wheelchair, stretchers, backboards, IV pools, then splints, bandages, emesis basin, then disaster ducts, pens, adhesive tap, oral airway, scissor, blanket, stethoscope, and emergency trolley with equipment. So this is all we need. Major role of nurses disaster means define the health needs to the affected group, established the priorities and objectives, identify the actual and potential public health problem, then determine the resource to the need, respond to the identify, collaborate with the other professional discipline and government non-government agency, maintain the unified chain command. So this is the disaster about everything. Okay, so last before class also critical something I can told about disaster injuries for the leg fracture and all we are already seen. So kindly go through these notes. Thank you guys.